Hi, I'm Gina Hale. I'm a special education advocate, and I'm here with Dr. Barbara Nye today in the American Migraine Foundation, and we're here to talk about migraine and school. All right. We thought we'd start by just asking you to use the chat, actually the questions area, to just share your name and what brings you here today. Do you have a child with migraine? Are you a teacher who is working with a child with migraine? We're going to talk about migraine, what it is in school, particularly. My piece is going to be about parent and student rights and looking at the three sort of intersecting laws that protect children in school who have special needs. And Dr. Nye is going to talk with us about how to work with your school around specific migraine issues. And then we'll think together about how to ask the school for what your child needs. So just quickly, yes or no, is migraine a disability? And you can use the chat here to kind of share your thoughts and experiences. I'm just going to give you a second to think about that. Awesome. Thanks for coming. Headaches just started, so brand new to this world. Yeah. Hey, Kathleen. 15-year-old with migraine and epilepsy. Hey, me too. Welcome to the club. Anne has a child with migraine. Awesome. So a lot of parents here, it looks like. Fantastic. We are a tiny but mighty club, very select few. So yeah, migraine can be disabling, and therefore it can be a disability. Migraine is the second leading cause of disability in the world. I was actually really surprised to learn that, and I put the link here at the bottom. This is on the American Migraine Foundation website under the resources tab. Lots of great stuff in there. I put this up and I'm not going to read the whole thing. I wanted to sort of splash it up in front of you so that you could go back to the World Health Organization later and look at how they think about disability. And this is also the way we're going to think about disability in school. Disability is about a person's unique condition, and so in this case, migraine, but it's also how migraine intersects, their experience of migraine intersects with the kinds of interactions and supports that are available in their lived environment. So a person's environment has a huge effect on their experience and the extent of the disability. A disability can actually be made worse by lack of accessibility. So when we talk about school and asking for accommodations or modifications or services to meet a child's needs, what we're actually talking about really is changing the environment so that it is more accessible and the environment itself is less disabling.
Miss Gina, it seems that the PowerPoint is not displaying, and we would love it if it would be shared up. I know you're giving such great information and pearls, so it would be.
Yeah.
There we go. Awesome. Thank you so much.
Hey, thanks for saying that.
Absolutely.
Right at the outset, and Dr. Nye, I'm sure you have sat in IEP meetings or 504 meetings. If you ever have, it becomes pretty obvious pretty quickly that parents are the only advocates for the child. And this is kind of this is a legal thing, actually, and it's something to just kind of keep in the very front of your mind. Parents are the only people at the IEP table who are legally allowed to advocate for a child. Everybody else is supposed to remain neutral, which sort of tends to mean skewed on the perspective of the school. So if you kind of feel like you're the only one there advocating for your child, that's important. And it's a time to say that to the team. And it's a great time to say, I think we need to reschedule this meeting because I need to bring somebody with me. It's always a bad sign if a parent feels intimidated while sitting in a meeting. So you're the only legal advocate unless the child has an attorney. And we'll come back to the attorney part later. This is going to feel like a whirlwind tour, but there's really only three things that we're going to get out of this next little section. There are 3 civil rights laws that protect students with disabilities, including migraine, in school. One of them is called 504, which is short for Section 504 of the Rehabilitation Act. One of them is called the ADA. You've probably heard of that, the Americans with Disabilities Act. And the other one is in school often called IDEA or IDEA. The Individuals with Disabilities in Education Act is the law that actually defines special education. And it's a huge old book, about 300 pages. And 5 attorneys sitting in the same room couldn't necessarily agree on what each part means. But it's important to know if your child needs what the school is calling an IEP, special education services, you're working in this framework of special education. If your child needs just modifications and accommodations, but not necessarily services, then we're talking Section 504. Section 504 defines what the right is, and it's the only law in the country that says people with disabilities have a right, a legal right to equal access. And this is a picture of Judy Heumann, fantastic disability rights advocate. And I really encourage you to go check out her TED Talk, Our Fight for Disability Rights and Why We're Not Done Yet. So 504 and IDEA and ADA. ADA is the law, oops, going the wrong direction. ADA actually defines what a disability is, and it's meant to be interpreted quite broadly. It's any physical or mental impairment that substantially limits one or more major life activities. And that major life activities includes learning. So if you have a child who has migraine, and that migraine is impacting their ability to attend school, be in school, learn in school, then they are considered a person with a disability. And through either 504 or IDEA or both, they can access supports that will help them stay in school and learn in school. In schools, we don't talk as much about ADA, even though that really important definition of disability is in there. In schools, we're always talking about either a 504 plan or an IEP under IDEA. IEP stands for Individual Education Plan. The processes are pretty similar. Each process begins with a request for evaluation. Evaluation just means that they gather a bunch of data, look at it, and decide whether or not this particular individual child has a disability and is eligible. In both processes, a team develops a plan to address that individual child's needs. Under 504, the team isn't really defined. Under IDEA, the team has to include parents and anyone the parent invites. So having met Dr. Nye now, if Dr. Nye were my child's doctor, I would definitely want to invite them to the meeting, maybe through telehealth appointment, or bring documents from Dr. Nye that had been discussed and developed in one of those longer patient meetings. Both a 504 plan and an IEP are based on evaluation data. Usually, a 504 does not include services. Schools like to give 504 plans because services are expensive. Schools like to discourage IEPs because, again, services are expensive. But services in special education include nursing. So if your child needs nursing services for migraine, they probably are looking into the world of the IEP, which is all good and well. An IEP actually has far stronger protections for kids and in many, many respects is better than a 504 plan.
One of the participants asked whether their child should have both of the plans. They currently have an IEP in place and whether a 504 should be evaluated as well. Can you address that while we're here?
That's a really great question. Thanks for pointing my attention to it. So, Allie, the answer is it depends, but usually no. Usually, in most states, if a child has an IEP, they can have a health plan that is attached to or part of the IEP. And anything that would normally go in a 504 plan, like the child needs to be excused anytime they ask to go to the nurse because migraine attack and the child can't talk while they're having a migraine, right? So that they might have like a little flashcard they hold up that just says nurse and they go. That kind of thing can go into an IEP, and usually a child doesn't have both. But just like a lot of things we're learning about recently, IDEA is implemented differently in different states. Every state has their own rules and regulations for it. Same with 504. So there's a couple of states where a student might have both, but it's unusual. And if my kids' team was saying they needed both, I would want to know why. Why can't those things go in an IEP? Because ultimately, if you ever have a disagreement with the school and you end up going to mediation or you end up going to talk to a judge, you want things to be as clear as possible because you may be surprised to know judges really aren't very good education experts and they get really easily confused and befuddled. And they don't like to be confused and befuddled. So you want to kind of keep the record as clear as you can. Located in California, you have either an IEP or a 504, but not both. And you can have what's called an individual health plan attached to the IEP. There are three parts, essentially, of or three ways to change the environment to make it more accessible. One is through services, one is through accommodations, and one is through modifications. So services include things like speech therapy, occupational therapy, physical therapy, a physician evaluation. Those are all services. It could include training for the teacher about what migraine is. It's not just a headache, right? We want the teacher to really understand. And when Dr. Nye starts talking about the kinds of things the team needs to understand, that's the kind of thing you can put into training, staff training. Accommodations are individually designed changes to a program that allow a student to access the curriculum or program. So ramps are a classic example for wheelchairs. They can include things like a fast pass. My kid has a fast pass and it's just a card that they hold up that says exit. And it's like for panic disorder, you need to exit right now. And there's no conversation, kids in charge, I get to leave, and they have a specific place they have to go. There's no conversation between the teacher and the child, and it's not something that happens publicly, right? They just hold it up in the back of the room and go. We call it a fast pass. Maybe they need a quiet place to rest. That's an accommodation. Maybe they need extended time on assignments that they may have missed because they were out of class for a period of time or unable to attend because they had that migraine fog going on. Modifications change the actual curriculum program itself. So modification might be everybody else is writing a 10-page paper, you're going to write an 8 or a 5-page paper. Everybody else is doing 50 problems for homework, you're going to do 25. So modifications change the actual curriculum. And it's important to not like get too wrapped up in the difference between accommodations and modifications, but it's just, I think, helpful to know once you start talking modifications, you're changing the actual curriculum typically, and we don't necessarily want to go down that road unless we absolutely need to. Usually we try the services and the accommodations first, and if those aren't working, we go to, okay, maybe we need to really change the amount or the difficulty of the work. All right, wash, rinse, repeat. The special education process can be sort of cyclic, recursive, and sometimes a little bit frustrating in the amount of times that you come back and come back and come back. If you're finding that you're coming back and coming back and coming back, it means that there's a problem. Every kid is supposed to have one IEP meeting a year, and all the things are supposed to be decided and written down and clarified in that one meeting. We've been seeing lately schools kind of dragging their feet and ending up having a meeting every month, and nothing's really decided until April. And then the team says in May, well, you know, we didn't really get a chance to implement this year, so let's start again in September. That can be super frustrating and really lose a ton of time for your kids. So you want to keep on top of the school and let them know that you understand the timelines. So here's the flow. Know your state's timelines before you start. And I'll post a link for you in a little bit. Every state has their own timelines. You got to go to your state Department of Education and download them. The most important part of initiating this process is to make a request for evaluation. That triggers a whole bunch of things that the school is legally required to do. As soon as you do that, start keeping everything. And a good friend of mine who has 2 boys with really significant needs says she uses pleasant persistence. And I love that because she's a fireball and she never lets the school get away with anything, but she's always super, super nice about it. It's like, hey, you know, I sent my request in 10 days ago and today's day 10 and you're supposed to have responded to me in writing. And I just wanted to let you know because, you know, we don't want to have problems later. So could you go ahead and get that to me? And boom, she always gets her little written notices. So remember, you're the only legal advocate. And it's really, really important to keep the school on top of those timelines. Before you meet with your team, prepare your evaluation data to share with them. It will probably be different than their evaluation data. Prepare your recommendations for services, accommodations, and modifications. These are really good to discuss with your child's physician. And make sure that your child's physician knows you want to have that conversation because it can be lengthy. It's not the 15-minute appointment, it's a longer appointment. Then meet with the team, listen to what they have to say, share your perspectives, and don't sign anything. Go home, take the paperwork with you, and wait for the school to give you written notice about their decisions. And if you're asked to sign an IEP or a 504 plan, say, you know, I just need time to process this. We've talked about so many things, and I'm really looking forward to getting your written notice about your decisions. We'll come back to written notice in a minute, but evaluation, there's a couple first principles to keep in mind. One is the school has to have your consent for evaluation. It's it's an important safeguard. It marks a timeline and it creates a paper trail of when things start. The evaluation can include written documentation from your physician. It can include your physician calling into the IEP meeting. It can include journals that you've kept of your kids' migraine history, right? The important thing is that evaluation has to be fair and comprehensive and address all areas of disability. And the purpose is to give the team really good data for decision making. A big pitfall in the evaluation process is that children can be observed and evaluated at lots of different times and with certain kinds of disability, migraine included. The child's disability may not be apparent in certain situations, certain environments, and at certain times of day. So it's really important that migraine is evaluated during the migraine attack so that the whole team understands exactly what it is that we're dealing with. And there's a link here. I think we will have a place for links for you later. There's a link here to the United States Department of Education. Has the whole IDEA statute online, so you can look at it and you can look at all the rules and all the regulations if you get to be like me, kind of wonky about the law. So here's maybe where Dr. Nye might want to step in a little bit. I thought one thing we could do is talk about some of the common issues that come up with migraine and think together and problem solve about how we might deal with those through an IEP or a 504.
Absolutely. And I'll just make a couple brief notes as far as the physician role. I like to make sure that, like Gina mentioned, there is adequate time for the provider and the student and the parent to really get together. It's not frequently that we get the request, but occasionally we get the request to just fill out this paperwork. And it's really important to have this open dialogue. And as we talk about some of these ideas, you guys will see that there's many different options, and if one person's making the selection, it may not be what the student wants or the parent wants, and so it does need to be a team approach and usually a prolonged appointment. I usually do 30 minutes to an hour for my IEP planning time and make sure we've got really good documentation, signs and symptoms, and it's usually more than one evaluation if we're really getting down to it. So yeah, let's start with these.
Nice. So as a person with migraine, photosensitivity is a big issue for me. So it's just one of the ones I tossed out. I know a lot of people experience that. Is that right, Dr. Nye?
Very much so. It's actually the most prominent symptom that we see with the migraine headache disorder, and noted as one of the most bothersome symptoms that we evaluate in research studies as well.
Wow. I have a kid who has epilepsy and migraine, and before she was verbal at like age 2, she'd start having an aura, and the first thing she'd do is crawl to a dark corner and lay down.
Yeah, they tell us very early, don't they?
Yeah, they sure do.
So I would say other things that I think we're getting some chats here and we'll keep looking at it, but one thing I don't see with a suggestion with fluorescent lighting, if a kid wears glasses, getting the glare reducing glasses, maybe blue light filters. I often recommend the rose colored glasses to be worn at school. Usually kids get a little bit more guff about wearing sunglasses where you can't see eyeballs and make respectful eye contact. And the rose colored lenses filter out that blue light, but you can still make eye contact. You can show that you're paying attention. So those are often one of my top suggestions when it comes to photophobia.
Oh, that's fantastic. We had a kid in school who was really sensitive to fluorescent lights for a different reason, but the teacher actually got these like little plastic murals almost of like clouds and sky, and just put them over all the light panels in the room, and all the kids loved it. So I love that example because it's a great example of universal design where the accommodation is sort of invisible to everybody else. It doesn't look like a wheelchair ramp, but a lot of people benefit from it, and it doesn't really detract from anything for anyone else.
Mm-hmm. It looks like this is a great segue for the question that was asked here about stigma. This is a hot topic and an area that's really important to address, both the stigma of migraine and, as this parent brought up, the stigma of creating an IEP plan. I think certainly, Gail, you're going to need to comment some more about this. I have lots of discussion with parents and students, although sometimes I get shy folks that feel stigmatized by this. It's often very apparent by the time we get to that point that there needs to be some help. So I don't experience it so much in the ask of the IEP as much as I do in the experience of the migraine headache disorder itself in the classroom, how the patient is perceived. And that's where I really encourage folks to engage with education of staff, nurses. Being in an academic headache center, I have offered to go to schools. I have offered to give my time, and there's many people that would really happily do those education series, and I'm sure there's resources available for nursing and for staff, but I think education is really important. I know when I was up in New Hampshire, I had gotten myself an invitation for a few different sessions at a high school to start teaching about stigma and having the conversation. We should probably be starting younger, honestly, but that was where I got my foot in the door. But I do think addressing that stigma and calling it out, it's one in 4 households has this headache disorder. So if a child isn't suffering from it, they probably have a parent or an aunt or an uncle, and they've seen the signs and symptoms. And to put a name to it, I think would be very important, and kind of defining that depending on what level your child's at.
Those are really great points. I like the training piece that you're talking about, Dr. Nye. And remember that training can be a service that can go in the IEP or the 504. I have come across stigma, but I think I'm also looking at Valentina's question. As a special education advocate, I'm usually getting the phone call from parents after things have been going pretty wrong for a while. So I tend to have a skewed perspective, perhaps, because I'm encountering more problems than success. And people don't call me when things are going great. But I do encounter a lot of stigma among parents. Like, I don't want my kid to have an IEP because those are the kids that ride the quote, short bus, or, we perceive special education as something for kids who are intellectually disabled. And I like to come to the table and say there are many, many kinds of disabilities. Intellectual disabilities are one kind, but there are many kinds of disabilities that make a child eligible for special education. Many of the disabilities are invisible. That doesn't mean that we don't need to address accessibility. And I think taking it from that accessibility perspective, along with the training piece that you're talking about, Dr. Nye, is super important to helping people sort of maybe shift their perspective and their position to be supportive and accepting.
It looks like we got a comment from Allie, who says her daughter's highly concerned about being on an IEP in a behavior program, not at her home school, wanting to be with her friends. She sees herself as an outcast.
Ouch.
How old is this child, if you don't mind?
Maybe while we're waiting for that answer, I could do a quick little insert about placement. So placement is the last thing we talk about in the IEP world, in the IEP process. Placement means where is the child going to receive their services? And the law is very, very strongly in favor of students receiving their special education services in homeschool in the regular classroom that they would attend if they did not have their home have a so I would be concerned that a child with headache, migraine, behavior class. I'd want to know more about that, and I think it's super important super important to not discuss people's individual issues. We'll have contact information if you need an advocate, and I'll have some resources for advocates as well. Here's another one. I thought we could kick around some ideas. Often, when someone is having a migraine attack, they need rest and access to medications. So let's talk about that, Dr. Nye. How do we advocate for that in school?
This is a really great point, and I love the rest and access to medication that we're not putting here, leave school. That is a really, really important point. Attendance is paramount, and we know that children are getting something out of school even if they're not at 100%. So even if they're a bit fuzzy during the headache or have that brain fog, there is some information filtering through. It's not the whole content. And so it's important to make a safe space that they can go rest, access their medication, have time for the medication to work, but also have the expectation of returning back to the classroom. And depending on the patients, some people get very specific about timing. Some people are able to say, I just need, somewhere between 20 and 30 minutes. Once the medication feels kicking in, I can go back to class. There's certainly a wide range of ways that you can approach this, but I do like the mention of returning to class and what are those parameters. There's also a question about accommodations for children with excessive absences due to migraine headache disorder. And I will touch on the fact that the American Academy of Pediatrics actually recommends that schools delay their start till about 8:30 based on sleep cycles, especially in the teen years. And interestingly, schools have not adopted these recommendations. And some of that comes from a very complex network of busing and after school activities. So it's not as easy as it sounds, because I've certainly racked my head around it and asked folks about this. But depending on the age level, you may advocate for having a study hall of types as first period and possibly moving through that, allowing them to get up a little bit earlier and treat their headaches if they're morning headache exacerbation sufferers. If they get them later in the day, again, load that coursework a little bit in the morning. Some people have the alternating schedules. There's a lot of variation there, but the goal is always to support as much attendance as possible. It looks like we lost Gina briefly. I'm sure she's trying to reconnect. It looks like Miss Valentina has a daughter that has some aphasia, and she's worried about how she would look in front of her friends. I think this is a really excellent opportunity to enlist the teacher and do a day of migraine education. Hey, Miss Gina. So we're just going forward. There was a question about kind of stigma associated with some of the headache symptoms, including aphasia, and how to address that in the classroom. And I was just saying that using this as a teaching opportunity is really an excellent way of integrating this and kind of going through what signs and symptoms. And I know during career day, we had a fun time kind of talking neurology at my son's school. So I think there's some opportunities to be creative and not put the patient in a spot where they feel stigmatized, but rather as a learning opportunity and some project creation type of thing. And most teachers welcome some of that and maybe some additional resources if we're lucky enough to have a headache center around. I have fellows that will soon need some projects. So there's definitely some things that we would, love to partner with students on, and I don't know how many of you are in kind of academic centers where we can be creative about some of these things. But the American Headache Society or American Migraine Foundation also has wonderful resources on the website, as you guys most likely know, to look for some creative solutions as well.
Nice. For my daughter who has epilepsy, we actually do a thing in the beginning of the year, every year, explaining what seizures look like and giving the kids roles. If you see this child having this symptom, here's what you do. And it sort of empowers everybody and takes away the fear. And I think stigma oftentimes comes from fear. So with younger children, especially, letting them have roles of what to do and know what to do can be very helpful. I love the idea of fellows needing projects. Send them out here. Let's see.
Well, it's a beautiful time that we have so much versatility in our communication, and I'd be happy to advocate for that as a fellowship director.
Nice. Before we skip over to procedural safeguards, are there things, Dr. Nye, that we need to get into that I didn't splash out there?
I think there were two. One thing I wanted to see, there's one question about successful accommodations for noise and loudness, especially in the gym. I have had, it's been mostly in teenagers, interestingly, some earbuds that can be helpful, some things that are more discreet often. Certainly, I think it's more common to see bigger headphones on kids these days, and that has been successful for some folks. But I am mindful of stigma inducing or perceiving, making them look different, and kind of assessing whether the child thinks it's cool or not, because that's part of the process as well.
Yeah, for sure.
And I think the only other things I wanted to bring to the table before we do the last couple slides, and you'll probably have to bring those back up. I don't see them anymore.
Thanks.
And no problem. I think we covered the kind of preparation associated with calling the provider's office. We like to be well prepared for these meetings as well, and getting a little heads up in the paperwork in advance and things to consider is often very helpful from a provider perspective. Let's see. And then I like to just come back, because these kids that we're talking about and advocating, we have to teach them to be adults eventually. And self-care is very important, and weaving into the routines why we need 8 to 10 hours of sleep, why we're addressing anxiety and depression maybe, making sure there's good hydration and encouraging that, having regular meals, depending on how you guys have that set up with your kids, 3 to 5 meals, don't skip breakfast, you know, looking at triggers, but also not creating anxiety over tracking triggers, kind of finding that balance. So I do kind of look back and try to impart some self-care and give the patients their role in those pieces, and how can they become a healthy adult at the end of the day as well. So I think that would be my 2 cents at the end there.
Nice. I think along those same lines, by the time kids are 14 or 16, having them learn how to run their own IEP meetings, and you know, step by step get into that role, so that we're not doing all the things for them and, you know, saying, hey, these clunky red headphones would be awesome for you.
Mm-hmm.
Then they feel like they're going to get beat up and their lunch money stolen. Can you see the PowerPoint now?
Yes.
Okay. So the last little piece of advocacy around IEPs is something called 10 procedural safeguards. And if you've been in the IEP world, you've heard procedural safeguards. I was talking to a friend of mine who's been doing this for a long time. And she said for the first 10 years, she actually never read the procedural safeguards and didn't realize how important they were. There are 10. They include, this is not the whole list, having things being presented in understandable language, meaningful parent participation, getting a written notice about things the school's decided to provide or not provide. Timelines are part of the procedural safeguards. Those are things that help you spot when things are maybe not going as well as they could. And helping the school understand that you understand your procedural safeguards and that you're a partner with them in the way I usually frame it when I call the school, if I spot a problem for a student, is say, hey, I'm really wanting to help with compliance. I know it's really important to you that you're in compliance, and this parent didn't get their written notice. So can you tidy that up and let's get it done? And usually schools are like, oh my goodness, we didn't realize, and then it gets taken care of. Again, the important piece, looking back 22 years later, the important piece about the advice from me and other parents to save everything, keep a phone log, is that things go along really well until they don't. And usually by the time they don't, you've thrown away a bunch of stuff and you don't have a phone log. And you're like, I had this conversation with so-and-so, but I can't remember when it was. Those are all pieces of information that you're going to need at some point if things don't go well. So it's sort of like having an umbrella, right? It's better to have and not need than need and not have. There are a few websites that are really great to go to. One of them is Understood. Another one is COPA. It's the Council of Parent Advocates and Attorneys. And then your State Department of Education. Some state departments of education in California, actually, ours is really super helpful. You can call up and say, hey, I'm a parent. I don't have an attorney, but I'm having a problem with school. And I just want you to help me understand what my kids' rights are and what my responsibilities are. And they will explain all the things to you really nicely. And then they'll say, do you feel like you need help with this? Because we have somebody in your area. So I really encourage you to call your State Department of Education if you feel like you're having a problem you can't resolve yourself. A teenager not wanting to be different, really fighting some of the accommodations. Yeah, not be your own worst enemy. I have a kid who's like that, and the way I deal with them is we try them in other places outside of school and away from prying teenage eyes. And then we talk about, well, did it help? Did it work? Do you think it would work at school? Is there a way we can do it that's a little more on the down low? If it does work, then it seems like something that helps. What's the consequence of not doing it? I think the best we can do with teenagers is help them understand their choices. Do you have thoughts, Dr. Noe?
I have to really agree with that. Yes, I have patients that are shy about putting on a neuromodulatory device on an airplane, and I have patients who are really excited about talking about it. And so there is definitely a spectrum there. And what are we willing to admit? What are we willing to talk about? And I think that changes a lot with time. I think if it's within the normal parameters of, trying to figure out how we can best help and trying to find some of these strategies that don't put them under their best friend's nose the first time they try something new is great. If we sense that there is an increased level of anxiety, there is certainly a very high rate of anxiety and depression in the migraine population. And I think we need to be mindful of that. Again, another area, unfortunately, full of a lot of stigma, but understanding that at times we need another specialist to help us change our perspective. Sometimes mom does a really great job of being able to do that, or dad in a different environment, but sometimes we need an independent person to help reframe how we think about things. We call it catastrophizing when we do that spinning out, and we go from having a headache to being a failure in X, Y, or Z, and you haven't even taken your first medication to try to solve that headache first thing in the morning. And You know, some of that is certainly normal, but also wanting to kind of find that balance of when do we need to ask for a little bit more help, and when is the anxiety and depression getting a little bit more than we can handle just as parents.
Mm-hmm. I know we're pretty close to the end of the time here. I see a question from Jennifer that I think is really interesting and helpful to address. What's the line, where's the line between being given medication by a nurse and needing rest and needing a 504 plan? And I'm saying this in hindsight, right? I have a 22-year-old who had an IEP for their whole life, and I have a now 18-year-old who's had an IEP for 3 years. Documenting things and putting agreements on paper, a 504 is really just an agreement between you and the school about what's going to happen when your child has a migraine. There's nothing at all wrong with having a 504. And things can change a lot when kids turn to be teens, when they're young adults. And that first piece of paper helps you establish a history and a timeline. And you can see things are getting better, things are getting worse, things are changing, things are not changing, things are stable. The school and I totally agree, things are great. Those are all outcomes of having a written plan. But a written plan, there's nothing wrong with that. And it's really helpful sometimes. So I would always lean towards that.
There was a question if there was a legal fee for the COPA organization. Is that an easy question?
It's easy. If you go to COPA's website, there are advocates and lawyers in each state. Some are low cost, very few are free, but there are some out there, and it's worth looking for somebody if you're really having difficulty. And your state Department of Ed can also provide you with a list of free and no cost attorneys who handle special education problems. Yeah, it's difficult when the school is fighting on really reasonable modifications. And I would say if you've made the request in writing and you've gotten the prior written notice, then it's time to find an advocate if you can't come to terms with the school.
Gina, I think one thing we haven't brought up is, when do you go to the school board? When do you go above the school itself?
Mm-hmm. So Lou Barber is a federal monitor, complaints monitor for IDEA, and he used to say there's 3 kinds of districts: those that are willing to and can, those that are kind of willing but they don't know how, and those that are just unwilling. And I usually don't go to the school board unless I'm dealing with a district that is just really, really recalcitrant, because the school board is a big stick. They come and beat the superintendent around the head and shoulders a bit. They get really angry with teachers when things are going badly. So it's nice to go to the school board when you can offer praise. And the only times that I've gone to a school board on my kids' behalf is when we're about to go to due process, and I want to let them know, hey, you know, you could resolve this. You could fix this. This is what you're supposed to do. This is what we're asking for. It's really reasonable. Let's take care of it and learn something that benefits all the kids that are like this.
And it sounds like the questions about having folks with having difficulty making some of these simple accommodations, I think education comes to mind was the first thing. Is this, I'm wondering who the person is that's saying no, and do they know anything about this chronic neurologic condition, which as a headache specialist, every document I start for migraine patients, anything, excuse from work or talking about an IEP, the first line says, patient is being treated for a chronic neurologic condition called migraine. And this is what it means. And so I think that's what comes to mind, is what education does this individual need to realize it's not just a headache, because it's not.
That seems really important. I think, Dr. Nye, when parents are feeling sort of, I don't know what's the word, that the IEP team is not really on their side, it's better for we have 3 rules: write down everything, never go alone, and always come prepared. Record your meetings if you can. That's actually 4 rules. I snuck one in. But never go alone is a great sort of way of operating, because there's a lot happening. in these meetings, and there's a lot of people there, and you're the only one there for your kid. So bring a buddy, bring another parent, bring somebody who understands migraine, dial your physician in, make that telehealth appointment to happen right during the IEP meeting, if that helps, but get people there.
Mm-hmm. Yeah, and I think sometimes we're too close to the situation and can't read the question of answering someone's education level or concern. So that's where having the second person taking notes and really reflecting on that is important.
There's a question about due process, and I think that if you're even thinking due process, which means going to see a judge, you really could benefit from getting in touch with an advocate in your state who knows your state's rules and regulations. Due process is difficult, and having done it now 5 times, I don't think I would do it for my kid without an attorney. I think we're about done.
Great. Thank you for a wonderful audience and great stimulating conversation here. We really appreciate all of you that took your evening, morning, or afternoon with us across the U.S.
Absolutely, and thanks for jumping in on the chat and the questions. That helps us too.